For the last couple of years, Steve Johnson has been dealing with the nagging discomfort of carpal tunnel syndrome.
Tingly, and it would get painful if it didn't, if I didn't do something about it. So half the time I was leaning over the bed and shaking my hand, and eventually it would go away. But we decided that this is probably something we should check out. And
That brought him to Dr. Kelly McKnight, who introduced him to a new type of pain relief procedure.
So WALANT surgery is an acronym. It stands for wide awake, local anesthetic, no tourniquet.
Yep, you heard that right. Steve and patients who choose this option are awake for their surgery.
The wide awake part is, I think, my favorite part. They're awake, so you get to talk to people, you get to know them a little bit better. But patients love it because they can drive themselves here and they can drive themselves home. They can eat breakfast and lunch. They can take all their meds. They can have a cup of coffee. It's really convenient for them.
Because it's a smaller incision and the patient isn't asleep, there's no need for an anesthesiologist. Instead, the arm is numbed for about 30 minutes prior, and the patient walks themselves to the procedure room. Scalpels and tools can be jarring, but being more involved in the process can actually be more calming.
Surgery is scary for a lot of people. And I think being able to do this Wallant surgery, having patients awake, is a really good way to lower the anxiety that people have. It's a good way, just to communicate what we're doing, what we're seeing, help the patients kind of through those like more scary, more stressful times. Being able to see what's going on with their hand, I think also provides a lot of benefits in terms of healing and how to take good care of it too. I also think that it also gives patients a good opportunity to ask questions. And I always offer for all my patients to see inside their hands.
so I had a nurse over here talking to me, and we were having a good time. And I was kidding Dr. McKnight a little bit, and I thought, well, maybe you shouldn't do this. This lady's got a sharp object here, cutting on my hand. But no, it was, she did a fantastic job. You can't hardly tell.
I actually have a lot that are interested in the work that we're doing and they want to see like, what does it look like in there you hope that it's the only time they will ever see inside their hands. And I kind of, lead with that. But I think it's really good for them just to be able to see, what we're working on. I'm a visual learner, and I think a lot of patients are as well. So being able to see that, I think, really brings it home and, solidifies what we've been doing.
For Steve, he's on the mend and looking forward to whatever the day brings. Only now, it's without that carpal tunnel pain.
Every day's a weekend. I'm retired. So I just won't have the tingly hands anymore. They did a super job. And their attitude and their friendliness and the care that they give the patients, it just makes the whole thing an easier process.